Allergic contact dermatitis, this is a delayed type 4 hypersensitivity. And the tricky thing about this is that sometimes it often takes a while to develop symptoms. So if somebody's wearing a piece of jewelry not very frequently, they may not actually make the connection that they're getting this rash from that piece of jewelry. This is the type of rash that you get with poison ivy, poison oak, all of your metal jewelry. These patients present with significant erythema. It's very, very itchy, and you can get very large vesicles, and bullae can be really pretty impressive. So ask about this on history as well. Your management is to avoid the inside exposure and then treat them symptomatically. They may need actually corticosteroids if it's a very severe case. So if you have some sort of severe poison ivy, poison oak, you actually may need a prolonged course of steroids to prevent sort of rebound symptoms, both oral and topically, over 2 weeks. Here's a photo of poison ivy. Avoid that because you will be miserable if you touch it. Here's a photo. You can see in the photo both vesicles and large flaccid bullae. So be aware that this can happen just from an allergy. This isn't necessarily necrotizing fasciitis. This is just allergic contact dermatitis. And here's another patient that was exposed to cream, pretty significant reaction, and looks pretty miserable.